So without further ado, I'm going to introduce our speaker. But before that, let me remind all of us that you can feel free to key in all your questions, all some thoughts that you have, even some comments. You can drop it in the chat. Starting from last week or in the month of September, we are exclusively on Zoom, and in terms of live, and we will only put this up on YouTube a couple of days later. All right, so without further ado, let me introduce Dr. Samantha. She is a chiropractor with Healthworks, and she's going to be speaking about the effects of prolonged sitting. Dr. Samantha, over to you.
Hi, everybody. Good evening. Thank you for spending your evening with us. And wow, look at the results, right? It really is sitting down. And the truth is that you're not alone. Most people nowadays spend most of their life sitting. I think now with MCO even more, last time I used to tell my clients, you wake up in the morning, you drive to work, so you're sitting. And then you get to work and then you sit down again. And then after you walk, maybe you go for dinner, you sit, and then you drive back and you sit again. And it's a lot of sitting. But now even more, right? I think most of us, we wake up in the morning and then we sit down and that's it. We don't even get up to move to the car. We don't even walk from a parking lot. We don't walk around our house sometimes even. So sitting is a big issue. Let me just share my notes with you guys and we'll go from there. All right, so what are the effects of prolonged sitting? And the question is your posture fit to sit, right? At the end of the day, what we do, how we sit, it's very important for our daily life. And it actually has prolonged effects. Now we can see that we also have heart problems due to sitting down. Of course, upper back, neck issues. That one is very common that we see. But it's even starting to show that it may be worse than smoking, which is kind of crazy, right? Because we all are told, don't smoke. It's bad for your health. But sitting for too long and not moving your limbs can be as bad, if not worse. All right, so let's get to it. So look at this survey. So this is a work from home survey and it was done in May 2020. So already more than a year ago. And at that point, if you think about May 2020, the pandemic was fresh. We just have been in MCO for about a month, we haven't really gotten used to this lifestyle yet. I remember at that time, a lot of people were still trying to figure out like, okay, do we go back to work soon? And I think the whole world was in shock at that point, right? So in May, the whole world had maybe gone into lockdown for about a month, but you can already see the results of sitting down or just working from home. So 20,000 people, simple survey, 71 have a new pain or exacerbated pain, which means that maybe previously you had lower back pain. Now it's so excruciatingly pain, right? And if we look at what it means it could be back pain, neck pain, headaches, itchy, burning eyes. It could be anything. But nowadays we talk about just, how do we deal with these issues? I think some people have then started working out from home, which we have seen in clinic. A lot of people work out from home and then they come in also pain because now their shoulder hurts. Now they've exercised and they've injured their ankles, they've injured their knees, and they don't really know what to do, right? But I would say that from last year till now, there's definitely a positive trend among Malaysians because dining out is no longer an option, right? So people tend to go for exercise more, they tend to go hiking more, and that's actually really positive to see. But we can see how working from home, sitting at home is a problem. What is posture? So posture is your ideal body mass distribution relative to anything that you do. So very commonly when we are young, our parents will say, oh, sit up straight, stand up straight, But nowadays we're realizing, okay, sleeping, there seems to be a posture that we need to have. And a lot of people forget moving. When you move, there's a specific posture you should have too. What do I mean by that? So how many of us started exercising during MCO? Right? We go for runs, we go for jogs, and we think after we run and jog, we should feel better. But I'm starting to get this upper back and neck pain, headaches after running. I don't know how many of you can relate to that, but I would be honest and say, even if I go run after a long day of sitting at a computer, I have a similar issue. Why? It's because when I run, my head isn't above my shoulders. My head is carrying forward. The same way I use a computer, right? My head carries forward, and therefore it's causing stress to my neck and my upper back when I run. Similarly, when people go to the gym and they try to lift some weights, but when you're seated, look at the first picture of the sitting. You should be seated in a way where your pelvis sort of tilts forward a little bit and it's in a neutral position. If you realize right now that you're sitting in the lower one where you kind of lean backwards a little bit and you can feel your backside sort of roll back, that's the wrong position. So imagine if you go and lift something heavy with the wrong pelvis position, you will end up causing slip disc, pain in your lower back. Some people have shooting pain going down their legs. That's how it starts, right? So at the end of the day, how we sit or how we spend most of our day will affect our movement patterns as well. So let's talk a little bit about sleeping, wellness, and overall, right? Sleeping is something very common that clients ask me all the time. So instead of putting it in the chat as a question, let me answer your question before you even ask it, right? How should I sleep? Should I buy a new pillow? Should I buy a new bed? All the common questions. So this is what I tell all my clients. When it comes to sleep, try to keep your spine in an even neutral position. That means you can sleep facing upwards, no problem. If you have issues with the sleeping upwards, sleep apnea, things like that, sleeping sideways is totally fine, right? If you sleep sideways and you feel like, ooh, your body keeps rolling over, which means you end up sleeping facing down, put a bolster in between. You have to think like a pregnant woman, you know, they have a bolster in between or a pillow in between their legs. That helps you keep your spine neutral. That's what you have to do. The only way you shouldn't sleep is sleeping facing down. Because if you sleep facing down, that means that your neck is being stretched too much one side or the other the whole night, right? So you have to be aware of that. And so sleeping facing up, sideways is fine. In terms of pillow, in terms of bed, in terms of texture, hard or soft, which is better, I always tell clients, whatever helps you sleep is the best for you, right? Because when you sleep, your body relaxes. Our body is very special. We all know it's made in a perfect way, right? Let's put it that way, which means that our body compensates and it knows how to adapt to things as we go along. So if let's say we are sleeping and we are overstretching one side more than the other side gets stiff because it starts to pull, because it's trying to pull your head back. So whatever helps your body sleep at night, whether it's a hard bed, whether it's a soft bed, it's up to you. There's no right or wrong. The only thing is that if you're married, maybe your wife or your husband don't agree with you because everybody has different bodies, right? So that's the only challenge lah. I got clients to tell me, wow, I went out, I saw a sale, I buy all 5 pillows for my family. Everybody's okay but me. Happens. But I tell them, I said, well, your neck is a different length from your husband, a different length from your children. It tends to happen, right? So you have to find what's right for you. Okay, let's move on. This is our spine. So when you look at it from the front to the back, the spine should look straight, but from the side, there are curves. It curves a little bit in the neck, a little bit in the upper back, and again, a little bit in the lower back. These curves are meant to distribute the weight throughout your spine. In between the bones are these, you know, now it's highlighted in red, those are discs. Discs act as like shock absorbers for your spine. So if you run, if you jump, even if you sit for too long, the discs will take the pressure. So that's why some people, when they sit for too long, then have you ever had a friend where they say, oh, I sit for too long and then I get up and suddenly my back cannot move, right? Like suddenly you just can't move. That's because the discs have been absorbing and your muscles also get used to this position. And when you move too quickly, because it isn't warmed up, it tends to seize up. Yeah. Also very common, people who sit for too long, or if they put too much pressure in their discs, they don't do anything. They just sneeze and suddenly they have a slip disc problem, right? Because the discs have just been absorbing the shock and it can't take the pressure anymore. When we talk about our body and our nervous system, it's very important because it's what connects our brain to the rest of our body. It goes through the spinal cord, it helps you breathe, it helps you smell, it helps you taste, and all these kind of things. So as chiropractors, we care a lot about your spine because it houses your nervous system. Yeah, so if you take care of your spine cannot get replacement surgery. Spine, you cannot go and, you know, get a transplant. It doesn't work that way. So you need to take care of the one that you have. All right. What happens when the power goes out? So as chiropractors, we would say, oh, there's a misalignment, or sometimes you've heard of the word subluxation. So these are all terms that we use to basically say your spine isn't in the right position. And what happens is this dysfunction causes the nerves to have dysfunction as well. It's easy to explain to clients. It's like, you know, if you put a pipe, right, and you put a hose and you want to wash your car. If at any point the hose, there is somebody who steps on it, or maybe a car rolls on it, what happens to the water coming out? Sometimes the water doesn't come out anymore. You can imagine that's like numbness and tingling in your fingers. You don't feel anything anymore, right? Because the water has stopped. Sometimes the water comes out extra crazy, extra hard. That's like shooting pain, sharp pain, electrical feeling going down your legs, down your hands. That's also when there's a problem with the nerves. Or sometimes it's like it comes, it goes, it comes, it goes. So that's the same thing. That's the feeling of like ants, or like, you know, people say like pins and needles. That's the feeling as well. So if you have any of those, it tells me that there is a nerve issue happening in your spine. It doesn't mean that the nerves are spoiled or the nerves, you know, are damaged. It just means that something is pushing on the nerve. It could be muscle, it could be bone, it could be disc, but there is a nerve dysfunction. The same way that happens, nerve disruptions can also cause posture stress, back pain, neck pain. Very commonly with clients who have neck pain, they have headaches because the stress in the neck and it goes up to the head. I'll talk about it in the next slide. And some people even go as far as to having metabolic disorder or even diseases. So in babies, for example, if their middle back is like the muscles are very tight, it tends to affect their middle back and therefore it affects their stomach. That's how babies get colic. They get very burpy. They have all these like reflux and things like that. It could come from very simple things as a little stress in your back, right? How many of us recognize this picture? Honestly, I think even if we're in the office, that's us. If we're at home, that's us. When we don't want to talk to people and we pretend we are busy, this is us as well, isn't it? So usually I used to give talks in the office and I'll ask my clients, how many of you will come up in the lift this morning and you don't want to talk to anybody, so you look down at your phone, right? We all recognize this picture. This is what we call tech neck, tech snack, eye posture, anything to do with technology nowadays, we recognize this problem. So let's look at the shifting of the right side, which is the X-ray, and later I'll give you another one that's a bit clearer. But could you see how from a curved C position, it gets straighter and straighter and straighter, and now it even leans forward, right? Our head is the weight of a bowling ball. Every inch it goes forward, it puts about 2 kgs onto our upper back. And that's why at the end of the day, your upper back around this area is so tired. And everybody does this. They go, oh, they stretch. And sometimes it even has a clicking sound because your neck has, has been carrying so much and your muscles are so tight now. These are the 4 stages of what we call spondylosis, right? Normal, you see it's a C shape. Stage 1 is a bit of a straightening of the spine. Stage 2 goes forward, stage 3 even more. And if you look closely, it starts getting blurred. There's a bit of degeneration that starts happening. For those who know how to read X-rays, you would see that there is a diminishing of space in the discs and things like that. And usually when you hit stage 2, stage 3, you get the numbness in your fingers, you get the headaches because now these muscles are so tight, it causes headaches and you don't know why. You go to the doctor and they give you just some pills. They say you just have to learn to deal with it or live with it because no doctor can replace it and they're not going to do surgery for it. It's too dangerous, right? So they usually say just deal with it, just live with it. And the truth is with chiropractic, we can help you. It's not a problem. But to regain the curvature of your spine once degeneration occurs is very difficult. But you're not alone. A lot of people have this issue now. So here's the good news. Don't worry. There are things you can do, simple things. I'm going to go through some steps right now for you to prevent this sitting disease. All right. So number 1 is what we call diaphragmatic breathing. So with diaphragmatic breathing, you just have to breathe properly, right? So if some of you here, maybe you all sing, you wonder, oh, how come after singing, I feel so tired in my back? I don't know if you all have done like, long sessions of singing. Karaoke hasn't been open in a while, so it's quite difficult to say, right? But if you're a singer, you would realize your neck and your upper back feel very tired after singing if you are not breathing properly. It is also very common. So they always say what? Breathe from your stomach, don't breathe from your chest. So I'm going to teach you today how to do that, all right? So you put one hand on your chest and one on your stomach, and you take a deep breath in. When you breathe in, if you feel your chest moving, it's wrong, right? You need to feel your stomach moving. We have 3 breathing muscles: stomach, chest, and neck. All 3 are important, but they work at different times. So when you breathe in deeply, you breathe into your stomach first. How do you do that? So it's a little bit difficult to show you, but if you put your hands like in C shapes, like cups, and you put it around your hip, so above the bone, right? You put it on basically your stomach, but above the hip, and you just do ha, ha, ha. Or if you breathe out sharply, ha, ha, ha. Or if you end up laughing, it's even better because then you can really feel the muscles, right? And when you feel the muscles, that's when you know that's your stomach muscles moving. So now try to engage those muscles when you breathe. So again, hands up on your chest, one more in your stomach, and you breathe in. But now engage those muscles that you ha 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 and you laugh about and you can feel it. That's the one you should feel. Breathe in, and then your chest, and then your neck. And then when you breathe out, the opposite. Neck first, then chest, then stomach. If you do this, even if you're running, you're exercising, but you do this form of breathing, you will recover faster. It's the truth, and I would like you to just try it. So it's very easy. Just try it every day. Breathe in, breathe out. It already helps expand your chest and therefore relieve your neck and your upper back as well. Second one is what I tell all my clients. This is the easiest thing. It's called 30-30. Means every 30 minutes of sitting, take a 30-minute posture break. At the end, I'll show you a video of some posture breaks you can do. But a very simple thing is literally to get up and move around, right? Sometimes we tell clients, put a timer on your phone. Everybody has a phone. Put a timer, 30 minutes. Or we used to joke with our clients, drink more water. If you drink water, you have to go to the toilet. So you get up and you move anyways, right? But just reset your posture. Another tip we also tell is if you walk through any door, you stand up straight. You reset every time you sit down, every time you stand up. So then you keep remembering to do so, right? Maybe every time before a Zoom meeting, if your life is full of meetings, okay, before a meeting, I need to sit up. I need to do things properly. So you can give your back that kind of reset that it needs so that it's not stressed the whole time sitting down. The third one is standing up. So this is very common. It's very easy nowadays. There are so many options. I think constantly I'm being shown the ads for a new table, but you can also just use something that you already have, right? Lazada has a lot of standing desk options and it's very easy, or literally just stand up a little bit and move around, which brings me to my fourth one, which is move and work. Nowadays, a lot of our life is talking on the phone, having meetings, things like that. And we're so used to it. We sit down and we have a meeting. Why not next time you have a meeting, walk, right? Walking actually gets your blood flowing. And if it gets your blood flowing, it gets your mind flowing. A lot of clients will say, oh, but if I'm at work, how can I stand up and move around? It's a bit awkward, things like that. But you're at home now, nobody even knows, right? Most of the time, let's be honest, you don't even have your video on, which means you can do squats, you can be doing push-ups, anything you want to do. So make it a habit, right? Like if you guys are leaders in your workplace, you could even make it a habit for your workplace. At our clinic, people stand up and move all the time. And we don't think it's rude. We don't think it's anything. We think, okay, as long as they're listening, you know, as long as, and so we need to change our mindset, have a paradigm shift about moving and working at the same time. The next one is, of course, sitting properly and activating your core. So easily you can get an exercise ball that helps quite a lot. If let's say you're sitting on your chair a lot and you end up sitting on a ball, it might be better to move around a little bit, or you can invest in something like a back joy, because the back joy will help you keep your back in a neutral position. So if you don't have any back pain, or if you want to do prevention, you can try these methods and usually it helps. The sixth one, of course, as a chiropractor, we always say, check your posture and check your spine. Try to figure out why you have these issues. Sometimes people have long-standing issues that they don't understand why, or they don't know. So they don't actually find out what's the issue. And that's quite dangerous, because that's how you get what we call chronic pain. So when a client comes in to see me and they say, oh, Sam, I have this pain for the last 2 months. I'm like, no problem. 2 months, never have before. Let's sort it out. But a lot of times people will tell me, oh, I've had it for a year. I've had it for 2 years, 5 years, 10 years. When I'm pregnant with my second child, which was like 15 years ago, I had pain. I'm like, that's a bit too long. You know what I mean? So check your posture, check your spine. You don't have to come specifically to us. You could go anywhere. There are a lot nowadays all around you. And you can just find out, okay, is there something that's more concerning that's wrong with my back, rather than just a little bit of soreness and achiness every once in a while. Yeah. So I'm going to recap. These are the 6 ways. If you want, you can take a photo, whatever it is. Breathing, posture breaks, standing up, walking around, active sitting properly, and of course, checking your posture and checking your spine. So I'm going to show you a little video now about posture breaks, and hopefully you get a good idea.
Nowadays, we are constantly on our laptops and mobile devices. At home, we can try our best to reduce postural stress by moving around and exercising. At work, however, sometimes we just cannot afford those luxuries. we are bound to our desks and develop poor postural habits. Here at Healthworks, we recommend all our patients to implement posture breaks. Here's how you can implement a posture break at your desk. If you're required to sit, you can hyper out your lower back, upper back, and tuck in your chin. Hold this position for 10 seconds, engaging your postural muscles. You may repeat this process every 30 minutes. This will help you return to a healthy range of posture. You could also use a standing desk. When we hunch over at a desk all day, this causes our lungs to not be able to expand fully. Here's how you breathe properly. You can put one hand on your chest and another on your core. Take a deep breath and inhale for 4 seconds. Exhale for 6 seconds. Your chest should not move, but you should feel your diaphragm expand and relax. Repeat 5 times. Instead of sitting on a chair at work, why not try engaging your core by sitting on a ball, or a back joy, or a similar device that helps you keep your pelvis in a neutral position. However, the best posture break is to give your posture a break. This is done by moving around for 30 seconds every 30 minutes. If you have any questions or any joint or back related pain, feel free to give us a call at Healthworks. Our postural and spinal experts would love to help you move, get fit, and be well. Thanks for watching, and we hope to see you soon.